Thank you for allowing me to be here to spend a couple of minutes to talk to you about the communication problem that patients with or individuals with Parkinson's disease tend to have to face. So my standpoint is from as a speech pathologist by training, and I'm also a researcher. I love to kind of dissect all the approaches to see what work, what don't work. And so this is just a little bit kind of sharing with you about what's the current treatment options out there that you may consider if you do have trouble with speech function. So as Dr. Stewart mentioned about, there's a benchmark or common characteristic about Parkinson's disease that will be rigidity, bradykinesia, and also tremor, which also can affect communication or speech function as well. And not everyone, not all the individuals with Parkinson's will have speech problem, but more often than not, they do. And it can happen probably early on in the course of disease, or it can happen later, but they tend to deteriorate or worsen over time as the condition progresses. So the common characteristic of speech changes that an individual will notice with Parkinson's disease will be a reduced volume of their voice. Their voice becomes gradually softer, sometimes that you are not even aware, but your family and friends will say, well, can you repeat that? What did you say? And that usually is a sign that your speech maybe is too soft for people to understand you. And also, because of rigidity and the slow movements, they can also affect your articulation. So your speech may become not as precise, not as distinct, and it even have some stuttering tendency. You may kind of stutter that you never had it before, and now start to notice about some kind of stumble over some sounds. Interestingly, even you have slowness of your movement of your body. Actually, your speech tends to be rushed, go very, very fast. Although your articulation will be very limited, you don't move a whole lot, but you move very, very fast. And could be making the speech not as intelligible as it's supposed to be. Also, there's some interesting phenomenon actually to do with rigidity, is your prosody, your speech prosody will become a bit more flat, not as animated as it used to be. You may also have noticed some reduction or reduced facial expression, also to do with rigidity. And very interestingly is most of the individual with Parkinson's disease, they are not aware about even the slowly progressive speech changes. Sometimes they say, I don't have a problem. And only when people ask you to repeat yourself and say, I couldn't hear you, maybe your speech is slurred, or could be your voice volume is kind of low. And very interestingly, this is some, according to research, there's some mention about this is some sensory feedback loop. This is somehow it's faulty. You don't really perceive the way that how other people perceive your speech-wise. So it's very, very importantly is if you've been asked very repeatedly to say things a couple times again in order to be understood, it could be the sign you do have some speech changes, and that probably, it could be the early sign of Parkinson's in some patients, and sometimes it happens later in their condition. So generally the tip will be, well, how do you kind of correct that? So think about, could be your speech become a bit slurred, you speak not as with the animation and energy, but also your voice volume. So best thing is to help people that you have conversation with is for them to see when you speak to them. So they can see your facial expression, they can get some clue and contextual clue about what's the topic of the conversation that you are engaging in. Also try to speak in the short and concise phrases or sentences so you can take a good breath to support your speech, but also try to take your breath frequently enough to support your speech along the way. And just don't stop breathing. That's, I think, the bottom line is your respiratory support has to be there. And you have to remember, just take a deep breath and support you, because the breathing actually is the power source of your voice. You need to have a good breath to be loud. You may even want to think that I need to kind of open my mouth a little bit and kind of exaggerate the articulation so you will become more distinct in terms of your the sound you pronounce. And you may even have to pretend mentally about the people you have conversation with, they have hard of hearing. So you will make yourself to speak louder because you feel like, well, they couldn't hear me because they have a hearing loss, and you have to speak louder. So literally you have to project your voice intentionally. Even you feel like, I'm speaking very loud, but when you see other patients, other individuals, or the listeners' expression about they couldn't hear you, actually that's a sign. Your volume probably is a bit too low. And so usually, probably some people even practicing oral reading about maybe some newspapers or some books. They can read out loud, just practicing the tips of things and kind of get used to. Just kind of keep up your voice or in your speech clarity. But currently, there's a couple of treatment options out there that is intended to increase your voice volume or help you to improve your voice quality and voice volume, but also probably your intelligibility overall. And some is more medical treatment that, actually, I skipped the video.
You want to go back to it?
Yeah, and let me go back actually there. The first one only. And we don't have audio.
You can listen real close. I can't read this real much. And try to understand. Get all my words out at once. And then they all one into another. And memorize them and down. Spoken understanding me. It seems that I can't read this real much. And try to understand. All my words out at once, and then they all one into another, and memorize them and down. Spoken understanding me.
So that is. So that's typical of the characteristic I just described. It's very rushed, almost a little bit kind of stuttering tendency as well. And the articulation, the movement is very limited, very consistent with we call hypokinesia. So you have limited movements but very rushed in terms of speech. And so that is typical things about when people say, "Oh, slow down." Sometimes actually the individual with Parkinson's, they're not easy to slow down all the time because you cannot remind yourself, "I want to talk this way." So this has to be some other way to make that happen. But currently, the treatment option, as I mentioned, let's go back here. One of the options actually is you need to consult with ear, nose, and throat doctors in order to see this kind of treatment. This is intended to inject some collagen into the vocal folds to bulk it up, to make it a bit fatter in a way, to thicker, so you can a little bit better closure on the vocal box. So this is the voice box. When we talk, those two sides should meet each other in the midline. And the individual with Parkinson's, they tend to have that we call bold shape of vocal box. So it's not closing completely. And that can cause your voice volume to become low, but also it can be breathy and kind of hoarseness in your voice quality. So injected collagen to your vocal box can bulk it up. So therefore, you can achieve a better closure, and consequently your volume can improve. Your voice quality can also improve. But it only deals with the loudness of your voice, and even quality of your voice. But other aspect of speech cannot be corrected by the procedure, because this procedure is a very local, very focused type of intervention to deal with voice volume and voice quality. But overall, your intelligibility, your clarity of speech cannot be helped with this, because this procedure would not address the underlying motor control. That is the main issue in Parkinson's disease. Another probably a quick way to fix your volume or compensate for your communication problem will be using some devices. One will be using amplifier, because your volume is low. Why not use the amplifier to increase the volume of your voice? So nowadays, the portable amplifier is so easy to get probably $200 per device, and is something you can wear on your head. Look very cool, actually, almost like a singer and rapper on TV. You see them, pretty kind of cool. And it's a very small amplifier you wear on your waistband, and actually it's good for teacher, particularly that you can project your volume without putting so much effort to it, and that can help the individual with kind of soft voice can boost their volume. Also, that some individual may choose to use some more high-tech. They want to use even some phone now. They do have app, and what it does is almost like a keyboard, so you can use the icons or even type in, and it can speak on your behalf. Bad thing about it is they are not you. They don't sound like you. They sound like a machine. They may even sound like a woman if you are a man. So it's, in a way, to me, it's not very practical, because it could be a short solution for a special occasion such as like today. But not necessarily it will be very functional in terms of your daily usage. But also, again, it does not address the underlying pneumomotor problem. So you're going to continue to have other issues, and this device is only a quick fix and very short-term gain only. But it is something out there that people have been using to compensate for their speech difficulty. Speech therapy can help as well. So usually the speech therapy will be delivered by speech pathologists, so you can definitely find wherever you are to find anyone who is licensed and certified to help you in terms of your speech, your voice, language, and even swallowing difficulty, if that's the problem you are facing. And the treatment goal for treating Parkinsonian speech will be, of course, addressing loudness, concentrating on improving the clarity of speech, but also improving the naturalness of your speech. So your prosody will be very animated, very natural instead of very flat. And that's one treatment. I'm not getting any bonus from this, so I'm not here to promote the product. But I'm really into this because I see the result. I did research about this, and the research is out there, and I found very convincing, very promising. I'm very excited about. I see people really benefit from this, so I'd like to talk about this. So this is called Lee Silverman voice treatment. It's been out there probably about 20 years at least, right? A lot of research being done, wonderful research, very strong research-based practice. And what it does is, this involves a speech pathologist going to work with you on a daily basis. So if you enroll in this program, it requires you to be devoted to it. Meaning you have to be seeing the speech pathologist once a day for an hour, and for 4 days a week for 4 weeks, meaning you will a total of 16 sessions. During those 1 hour sessions, they spend about maybe the first 30 minutes will be working on your loudness, your endurance, your voice, meaning you have to stretch your phonation time as long as you can. You change your pitch, changing your pitch range to stretch it as much as you can. And when you're doing those, actually that almost forcing you to work on your respiration, your phonation together. So this is the approach almost using a very simple idea. Just tell the individual that to speak loud. Because speak loud is a very easy concept. If I can explain everything to you, take a deep breath so you can go into the diaphragmatic breathing. You're going to speak this way, and you are using a lot of jargon. Something very confusing and very difficult to do. But when I say, I want you to speak loud, that's the only thing you need to do. It's a very easy concept, but by doing so, if I say, I need to speak loud, what do I do first? Right away, I'll take a deep breath, because I know I need to project my voice. So how are you? When I do this, I need to have good breath support. I put a lot of effort on my muscle, on my, not only the vocal folds, but also a lot of surrounding muscle as well. But also when I project my volume, I open my mouth. When we speak loud, you do open your mouth pretty wide when you speak. Project the volume. And that's exact. And then also when I speak loud, what's another thing going to happen? I tend to slow down, because nobody can speak so loud and speak very, very fast. So that almost served all the purpose that that Parkinsonian patient or Parkinsonian speakers will face. They have soft voice volume, they have slower speech, they have very fast speaking rate. Literally, this is really taking care of those. So I just mentioned about that 1 hour session. 30 minutes for exercises, the second 30 minutes, the last 30 minutes working on functional speech. So using a loud voice on working a speech protocol they have to follow through. So you have these sentences, you have to go into conversation, but using the loudness you gain and practice it. And when you go home, you still have to practice. You have home exercise to do, and you have to continue to practice. So what is very interesting about this is it shows results. It's pretty interesting. The reason is it's very intense and very frequent. So intensity in terms of frequent treatment and also about the high effort of the exercise you need to do in the treatment. It does work in terms of almost like physical therapy. It works. They even do the brain scan. They have found the brain changes after just the treatment because it really goes into the motor learning principle and changing a lot of underlying physiological, neurophysiological part of your brain and your body. And so it just really, but I think this will be the third time you're going to hear about this today. Is if you don't use it, you'll lose it. So that's the same principle. You have to keep it up. You have to maintain it. You still have to do exercise until you graduate or you complete the program. You still have to use the same set of exercise in the morning, at night, and twice a day, and keep up. And exciting about this actually is it did find even up to 2 years, the individual learned the approach, still maintain that effect, meaning that whatever they gain, it lasts for a long time. And so this is what is really exciting about it. It really does have very long-lasting effect. And I do have a video here. I'm just going to show you. This is from the supplement company over that foot right there. Okay.
It's funny. It's a flyer. It's not listed. It's not a.
Maybe we'll leave that.
I will pull it up. I'll pull it up off the website when we're done. So everyone can see it.
Okay. So what you would do actually just before the treatment, you see that the individual will have a typical Parkinsonian characteristics, and after treatment, you see the changes in terms even the facial expression become more animated, more energy, and the clarity of speech really improved. And what it will change actually not only the individual changed how they speak, but they also change about their dynamic with family. They are more engaging in their daily activity. When children can have a good conversation with them, they don't feel isolated because they are, people not paying attention. They speak so soft. So that is really make a big change in terms of their social activity and their functional activity. And we did, let me see, I have in your clue for that. So we had a study actually kind of follow about the changes over time. And this individual we display here. So even this is like 16 sessions of therapy, and sometimes we can even see the changes after 4 sessions. But you cannot stop there. Even you see, wow, these are reaching the goal. Let's stop there. In order to gain a long-term impact in terms of really going to the motor learning principle, you do have to keep it up until you finish a certain amount of exercise and keep it up. So therefore, the 16th session is no bargaining. There's no negotiation. 16th session is the minimum you need to be involved and really put your energy into learning the strategy and to work on it. And then afterwards, you have to kind of keep it up. So we found the volume had improved until they reach the same level as an individual without Parkinson's. But also their duration of phonation increased from very limited phonation. They take a deep breath, maybe just last for 4 seconds with a very breathy voice. After treatment, actually go up and they can last probably about 12 seconds and actually very good volume. And also their pitch changes ranges become wider, meaning your muscle become more relaxed and more dynamic, it can work. It just overall, I'm very convinced because we have seen not only individuals with Parkinson's, they benefit from this. We even try this with other populations of different conditions, such as individual with cerebral ataxia. We try that on patients with vocal paralysis, and try out all different type of people we think going to work, meaning they are going to give them more energy and more strength on their vocal and also their speech. And has been, so far, it really has not disappointed. So I'm really kind of almost want to promote this because I personally, I think it really, this approach has been very well researched and very well designed and has really gained popularity because it really worked. And actually about 40 countries probably have been using this and reporting in their research about this approach as well. And this is a couple of very good resources that you can find very useful information about speech difficulty and even swallowing in those websites, Parkinson Foundation, Michael J. Fox Foundations, even the Supplement Global, the company themselves have a lot of good research and information posted there to benefit us and also clinicians, but also to benefit the individual with Parkinson's. So this is speech problem that Parkinson's so many patients need to face, but also there's a hope there. This is some approach not cure, but definitely can eliminate the symptoms and make it work for individual can communicate well in their daily activities.